You have seen the issues that are happening in Kirinyaga, which started very well as an industrial action, but now it is a lockout. And this is the first time this country is experiencing a lockout, both in Kirinyaga and in Laikipia, where the governors and the counties and the county government, they are being mismanaged, they are being misadvised by technocrats, but they are also refusing to engage with the employers. This is unprecedented in labor law. It is also unprecedented in labor history. And let me make it very clear to them, to Governor Waiguru and to Governor Ndiritu, we will not massage your ego. We will not massage your ego. If you have an inferiority complex because of doctors, the best we can do for you is to treat your inferiority complex, but we will not massage your ego. And we want to make it very clear to any single governor, if you have an inferiority complex, we as doctors in Kenya are professionals who are trained to treat people. We are going to stick to our mandate to treat people, including treating your inferiority complex. Massaging your ego, that one we will not do. That one we will not do it. So if they are not interested in offering services to their citizens, which is the mandate of the governor, then they should look elsewhere instead of bringing these frustrations onto professionals. Professionals in this country must be respected, and not just doctors. All professionals must be respected. Professionalism must be placed above partisan politics. And we are very dismayed by what has been going on in Laikipia, where the governor is even comparing the number of doctors with the number of facilities. This is idiocy of the highest level. I mean, this is unprecedented of a governor, where they are saying they have 80 facilities and they have 100 doctors. They want to reduce the number of doctors to the number of facilities. Kenyatta National Hospital has 1,200 doctors, and they are not even enough. We have many places. In Berlin, there's one hospital with 3,600 doctors, the country's largest hospital. So we cannot start engaging in this partisan, deep-seated ignorance. If governors have issues, please keep those issues to yourselves. We are going to engage in things that are geared towards achieving universal health coverage, accessing skilled professional services to this country. And that is the path that we want to follow. So even as we continue to engage in lockouts, we want to request the citizens in Laikipia and the citizens in Kirinyaga, hold your governors accountable. Your governors do not have your best interest, because the doctors will always have options. They can be returned to the national government, a process that we have already started. But you, as a citizen in Laikipia, in Kirinyaga, you will remain there without a doctor to attend to you. And we are not going to bring any. So these governors must be put to a stop. And as doctors, we are not going to massage their ego.